Today's podcast episode with Mac and I is all about you're not crazy, your pain is real. For those of you who feel like you've been dismissed or being gaslighted by the medical community and your dentist, we want you to know that your pain is real. So listen to this podcast. It's all about the trigeminal neuralgia and also how TMJ pain comes about. I think it's really worth a quick listen. Mac, my good friend, so good to see you today.
Good to see you. So let's get started and we'll help some people in pain
All
by
right.
explaining the pain because it's very, very confusing. So you're starting. Let's go.
Let's get into trigeminal neuralgia,
Good.
okay? Because so many people suffer from that, and quite often it's misdiagnosed, right? So,
Right.
one of my fellowship cases is, I just got my fellowship, and one of the cases I presented to our board is a woman that came to me after she had been to the National Institute of Health, NIH, and she was diagnosed with trigeminal neuralgia. And for those that are listening or watching, trigeminal neuralgia is a horrific pain that even like the breeze going up against your skin can set you off in massive pain pathways. But anatomically, what I want you to understand that if it's true trigeminal neuralgia, what's happened is that one of the nerves in your face is compressed by an artery that lays right on top of it too closely. So there are different surgical procedures that can be done if it's real trigeminal neuralgia. Like you can have the nerve ablated, which means like using radio frequency heat to get that nerve kind of deaden it so you don't feel the pain sensory. They can do like a microvascular decompression where they elevate that blood pressure, that blood vessel off of the nerve. They can do glycerol injections. So there's different ways, if it's true trigeminal neuralgia, to treat it that are very effective. But 9 out of 10 times it's misdiagnosed, and it is due to a lack of balance of the jaw causing compression on that same nerve. So this lady came to me. We're just going to call her Mary for the time being. She had gone through the actual procedure, the gamma knife procedure, where they cut the nerve and it made her feel better, took her pain away for I think less than 4 months before she started to have symptoms again. Because yes, while having a surgery on a nerve will stop some of the pain pathway to the brain, like some of the receptors to the brain, if the true area that's the problem is not addressed, your symptoms are going to come back because that area was never really focused on. So she came to me and, Mac, we work on that trigeminal nerve, but I was like, let's keep it simple using the CT scan technology, using the EMG technology, like where the muscles balance, where's that joint supposed to be, and created one of those neuromuscular lower physiologic orthotics, literally just giving her a bite splint that balances out her muscles and keeps her joint in the right place. And I said, let's see how it goes. And she was in that, I had to show the whole thing for my case presentation. She was in it for about 4 to 5 months, but in that first month was the first time she could actually touch her left side of her face. This is a mother of two, a wife, a working woman that was completely spiraling out, thinking she's crazy because she's gone to, quote, the best of the best, had a massive procedure done with a scar the size of my hand on the back of her head. And at this point, her whole life is falling apart. So she is in tears because of pain and also the psychological damage. And so I said, let's just make this appliance, see how it goes. Within a month, she was 70% better of all her symptoms. We continued the treatment with her. She stayed stable very well. And then we decided to move into orthodontic treatment to move her teeth into that position so she doesn't have to wear a splint all the time. And then, now she's been in my practice for I don't even know how many years, doing very well and holding
But
stable.
you knew the position that you were headed to before you started moving teeth or touching teeth.
Absolutely.
You
Bec-
got to know the position first. Now, here's, patients aren't listened to. We know they've been kicked down the road. Guess who else is not listened to? Dentists like us. We're not listened to. And it's a shame because we do have the answers. You and I just got back from Japan. We had dentists from all over the world saying the same thing, treating the same way. Now, back to trigeminal neuralgia. It is a very specific symptom. You know, when they come in and you go through that extensive interview that you do with your TMD patients, and I did with mine, it is that when they touch like this and it hurts, or they walk outside and the wind blows and it hurts them, that's a very specific sign for trigeminal neuralgia, which is a medical condition. Supposedly is a medical condition, but you and I both know that what we do can help. Now, if I had tried, I would do just like you. Let's try this to see whether it helps. Because when you get all of this balanced, and if that trigeminal nerve is being pinched or pressure on because of some obstruction, or it might be caused by this not being in harmony. So when you make that orthotic that puts that jaw and joint back into harmony and puts the muscles in harmony, then things start settling down. So, but the problem is we're not listened to as dentists. MDs are not going to listen to us. They're going to see a patient that's a headache patient and they're going to diagnose it as trigeminal neuralgia, or they're going to diagnose it as a migraine. And when the diagnosis is wrong, it's not going to work. It's as simple as that.
Yep.
So, yes, and the purpose of these podcasts is for people to learn this, and so that the MDs are pressured into looking into what we do or did every day of our lives in our practice, helping patients with this severe pain that nobody knows how to help them. And we know how to help them, but nobody's listening in the
Mac,
purpose of the podcast.
exactly. Like just this week, I had another new patient come in, male in his late 30s, and he has TMJ pain. And he literally told me in this day and age, just outside the DC area, okay, we have everything at our fingertips and our phone for information. This day and age, he was told by his medical doctors and other people he seek care from, even his dentist, saying there's no cure for TMJ. You have TMJ, that's pretty much that's your cards you're going to deal with for the rest of your life. And so this is again to our listeners, this is why we create this podcast. We're here to, hopefully get other practitioners to open up about the way to like look at people and tell people that there is an answer if they have the time and the care to want to listen to your story and diagnose correctly, because you poor people feel at this point like you're being like you're being gaslighted by your doctors. And I share that frustration. Mac, he doesn't need to be doing this. I mean, he's retired and he just even wrote a book to get patients like you to have answers and be able to almost go through the book and like diagnose yourself to see, okay, this sounds like me, or my website has a wealth of information too, marsvandds.com. Go there,
Yeah.
go to the TMJ tab, okay? But just listen to these podcasts, send them to other people who complain of headaches, migraines, clicking, popping, ear issues. It could be TMJ issues, but you just need to find a doctor like me or Mac.
And for complete guidance on how to do this, just go to Amazon, type in the TMJ trifecta or Dr. Mac Lee, and you'll get my new book. It's been released about a month, but it's very comprehensive. And we do have this discussion within that book.
It's
And
comprehensive,
education
but
is
not
everything.
difficult to read. I mean, it's so easy for people to understand it and navigate through
Right,
it.
right. So it's in patient language like this is, but hopefully our dentists are listening and MDs are listening, ENTs are listening to say, maybe I need to learn about this thing called TMD and maybe I need to listen to the dentist.
And one more thing to our listeners, because you can tell we get a little riled up in here. And by we, I mean me. I can't help myself. But it's the other thing that it gets me really razzed, as Mac knows, is like talk to your freaking insurance companies. I mean, they
Oh,
don't
yes.
cover this, and it's ridiculous because they'll cover surgeries that are most of the time ineffective. So I think if as we all keep continuing to push boundaries that need to be pushed for your own health benefits, um, we just have to keep at it with the insurance companies and getting doctors to get out of that insurance treadmill so they have the time to listen to your needs, because you're not crazy. And I can understand why you feel like you're being gaslighted.
So, Pam, have you ever had an insurance company call you to get your opinion on whether it should be covered or not? No.
Not a chance.
It's not a chance. They don't even know we exist. They've got us in between being medical and being dental, and they're going to use whatever they can so that they can make a profit. It's real simple. It's not rocket science.
Yeah,
You
it's not. Your pain is real. You're not crazy. There are solutions. You just have to find the right doctor to help you.
and be educated. That's correct.
That simple.